know that the public health team will have given an update this morning, but I'll just touch briefly on the data from today. We've got 1,447 people in hospital, including 92 people in ICU, 47 of whom are ventilated and 3 are on ECMO. We have 9,995 positive test results, and that includes 5,747 positive rapid antigen tests and 4,248 positive PCR tests. And those PCR tests, the 4,248 positive PCR tests, were out of a total of 44,316 PCR tests. And sadly, we reported the deaths of 14 people, 10 men and 4 women. And can I pass my condolences on to the families for their losses. I would actually just like to have a bit of a talk to the community about what 2022 will look like. And I think it is important that we change our horizon of thought from the immediacy to the long term and engage in a dialogue with the community about what that will mean for them. So Omicron may be the dominant strain and its sublineages, so the cousins of Omicron as we call it, the BA2 and BA3, they may continue to be the dominant strain. But we will need to plan and prepare for the emergence of new variants. I think it's been surprised many, maybe not surprised some, at how prolific COVID has been in throwing off variants. And for a variant to get established, it needs to actually be more transmissible or escape prior immunity or vaccine immunity. So it takes a bit of effort, and COVID's certainly thrown us some examples of how it has changed, and we have to be watchful of that. We also need to consider the resurgence of influenza, flu. We haven't had a flu season for the last couple of years, but with borders open and we have seen flu come back in the Northern Hemisphere, not in a big way. And the reason for that is the measures we put in place for COVID actually protect against flu getting out of hand. So those simple things, those hygiene messages, staying at home when you work, when you're ill, wearing a mask, they're actually very effective at suppressing flu. So we have to plan for a bad flu season, but it's not inevitable that we will see one. There will likely be further waves of COVID as vaccine and infection-derived immunity wanes. We need to be clear about this. So even in the context of no new variants emerging, we can expect further waves. At the moment, we've seen a stabilisation in numbers with slowly declining hospital and ICU admissions. And as I mentioned, Omicron BA1 is the dominant strain variant, but we're also seeing indications of an increase in BA2 and need to be watchful of what that means. Going forward, we need to continue to have a very flexible and proportionate response, and we need to monitor the situation closely. We'll need to have an ongoing focus on high-risk settings that are vulnerable. And by that I mean the aged care facilities, hospitals, corrections facility, disability care settings. We know that older people and those with underlying health conditions will continue to be hit hardest by COVID in the coming years. On a positive note, and we need to be really positive, is that vaccines are effective. They've really held up against severe disease and hospitalisation. And we also have access to new antiviral therapies. We also know how COVID is spread, and we know what controls it. So we know how we can act as an individual to protect ourselves, our loved ones, but also how we have to behave to protect those most vulnerable in our communities. And I would urge the community to continue to think about those who may be more vulnerable to risk. So the things that we know work are staying at home when you're sick, a really simple thing. And we probably, regardless, even if COVID diminishes, it's probably a really good thing to stop all those respiratory infections going ahead. Good ventilation. COVID has really brought into fore the emphasis we need to have on good ventilation. And things like mask wearing. We know that they are a really good risk mitigant. It is likely that we are going to need to roll out additional doses of vaccine. It may be that is then targeted at those who are most vulnerable at severe disease. But we know that ATAGI is being very watchful of the rollout of the fourth dose in countries overseas, and is mindful of updating and frequently revising their recommendations. And so the change in terminology to up to date with vaccination is really very important for all individuals, and so the vaccination schedule that one individual has will be different from another. So it brings it into the fore of how we normally approach immunisations, with sometimes different recommendations for different groups depending on their age and their underlying health conditions. So as we progress through 2022, we need to ensure that we balance and are proportionate in our response to COVID, and balance our response against the harms or other mental health and health impacts we might have. And I'm particularly keen that we work collectively with the Commonwealth on the age sector response. I mean, clearly we understand that serial isolation of frail elderly is not a good outcome, as the Ministers previously discussed revising some of the visitor policies. So 2022 will be a year of recalibration, but I think we have to continue to expect the unexpected in terms of the emergence of new variants, and we also need to expect new waves. But I would ask all the community that even though we might move away from mandates being proportionate and measured response, that everyone has to make their own contribution to keeping themselves, their loved ones and the broader community safe. And I am really reassured that the community has been adopting so many COVID safe measures. So thank you.